Hey guys, this is Dr. Sterling Petersen, and today I wanted to talk to you about something that I've been doing in the clinic and something I've been using, and that is Kinesio Tape. So I cut some samples. This is kind of what it looks like. And first I just wanted to start off with, what does this tape do? So Kinesio Tape, just to get into the slightly technical terms of it, it creates convolutions of the skin, which affects the interstitial layers beneath the skin, which then allows the lymphatic fluids to move more freely, the blood to move more freely, and in turn that changes how the pain is perceived and also how the muscles and all the tissue underneath it interact. So now that I've gotten all those terms out of the way, what does that mean? So this was created by Dr. Kinesio Tape, and the idea behind this tape was to act as a second layer of skin, the top layer of skin, also known as the epidermis, but in order to have a bit more specific purpose on a targeted area of the body. So what this will do is this will change how the skin interacts with all of the tissues beneath it. So anyone who's injured, it'll change. It will allow you to heal better. It will allow the fluids to move better, which in turn allows you to heal better. It can also help you perform a sport, an activity, without causing any restriction. So if you've had this on, this lasts for days, a week, or more. If you've seen the Olympics for the past 2, 3, 4 times, you've seen volleyball players with it all over their shoulders, their back, knees. Even NBA players are using this tape because of the value that it provides and allows them to play a sport while also having a therapeutic benefit. And there's no limit to what or to who this tape can be used on. It can be used on athletes, as I mentioned before, but also a weekend warrior, adults, kids, geriatrics. It can be used on just about anybody, and there's a wide range of uses. So just in the office, I'm using it a lot on shoulders, knees, ankles, wrists, the back, for posture. There's so many uses that it's amazing. So it's not just for soft tissue. It can be used to help support the ligaments, the tendons. It can also be used to facilitate a muscle, which means to help the job of that muscle be easier. And it can also be used to stimulate a muscle, so to get more activity and action out of that muscle. So, and it all depends how it's applied. If you've purchased this on your own and you just applied it on yourself and you're like, well, I didn't really feel much, the reason is because there's a specific way that it should be applied. And I would highly recommend that you go to somebody who's had some training in this tape, because you will see a massive difference. There's all different ways that you can stretch it, and in regards to which areas you want to be stretched versus which areas you want to have no stretch. And that can drastically change how it interacts on your body and with your skin and with the activity and the motions that you're doing that you want to help with. So let me just show you what it kind of looks like. This is actually pretty cool tape here. So it was designed to have a fingerprint-like type of thing on it. I don't know if you can see that there. Let me just change it in the light. You see that? So it's got like a fingerprint, and it's got good stretch as well. So this is a cotton, it's latex-free, allergy-free. There hasn't really been anyone who's had any issues with it, but it's pretty cool, and it's very sticky. So it will last 3, 4, 5 days, and it can stay on even if you shower, you play in the water, you sweat. So there's a lot of good value, and I just kind of wanted to talk to you guys about that. Also, one thing I wanted to say is that there are a few different types of brands with this style of tape out there. There's Kinesio Tape, KT Tape, Rock Tape, and they're all pretty good. I would say, you know, everyone has their own preference. This is just the type of tape that we have here, but it does a lot of the same things. They're slightly different, and there's also slightly different variations. So there are some that are used for athletes that are a lot more sticky, that will allow that person to sweat more and it'll stay on, and there's some that are a bit more gentle. So it depends on what you need it for. So, and that's also why I would recommend you go to a practitioner, a physical therapist, a chiropractor, a trainer, anyone who's just been trained in this type of taping. So you can do that online if you want to check it out. There's some cool ways to be trained in it if you're interested. But if this type of taping sounds interesting to you and you're interested in possibly getting it done, or you just have some more questions, let me know. Would be happy to answer them. And if I see you as a patient, come in, ask me about it next time, and we'll see what we can do for you. All right, well, I hope this was very informative to you guys today. And as always, stay healthy, stay happy, and I will see you next time.